that job.
Great, great. So in which process you were there in that?
Sir, I was in AR for the DMEs. I work for commercial insurances.
Okay, but still there would be a process name, let's say, like you said.
I was in Adapt. Adapt.
Okay, all right, great.
Yes, sir.
So you said your specialty is only DME, right?
Yes, sir.
Never worked in physician?
No, sir. I was in DME actually from the starting.
Okay. So you must have the trainings and everything done through NAT, right?
Sorry, sir?
You must have all the trainings done through NAT?
Yes, sir.
Medical billing training?
Yes, sir. It was my first job.
Okay, so it was like around 1 month?
The training period?
Yes.
Sir, it was of 2 weeks.
2 weeks, okay.
Yes.
All right. So you're basically aware of all the medical guidelines and everything, right?
Yes.
All right. So what was the major denial you received there in that?
Sir, I worked on a lot of denials, and some of them are the impact of prior payer adjudication, or attachment is required, or EXP after coverage termination, or for the past TFL, for inconsistent modifier, or deemed not medical necessity, and then lapse in coverage, and then claim not covered by payer. And
so basically you worked on every denial, right?
Yes, sir.
All right. So have you also worked on Medicare?
No, sir.
Okay.
Medicare was a different process.
Okay.
So,
all right. So are you aware of HIPAA and PHI?
Sorry, sir?
Are you aware of HIPAA and PHI?
Yes, sir.
Okay.
Also, yes, sir. Also, HIPAA stands for Health Insurance Portability and Accountability Act, and according to its rule, we are not allowed to share the patient information with any other entity unless patient sign the document where we are allowed to share the information with provider or insurance companies. We have to store the information electronically.
All right. What about the PHI?
Also, it's protected health information. We have to maintain the patient information in data, in electronically data. Okay. And we cannot share any information without his consent.
So, what would be the difference between this HIPAA and PHI?
Also, HIPAA set the rule which we have to follow. Like, we are not allowed to share anything. It is illegal.
Okay.
And for PHI stands for protected health information. We have to protect the information. Like, we have to cover our computer screen. When we are logging off, when we are going away from the seat, we have to log the system like this. We are not allowed to use the mobiles on the floor. We are not allowed to write anything on the paper, any information regarding the patient.
Okay, all right. So, as you said, you worked on every denial. Can you explain me the difference between referral denial and an authorization denial?
Yes, sir. Sir, when a primary care provider refer the patient to the other specialist, in this case, we need the referral. Okay. And prior authorized, like when we are going to take a service in prior, we need to inform the provider. And sir, we need to contact the provider and the just give me a second.
Okay, while taking the authorization, do we need to inform providers?
Sir, first we need to visit the provider and we can say I'm not getting the proper name. We can say the PN will inform the insurance company that this patient is going to perform this service, and then the insurance will provide us pre-certification number. Then we have to mention the same on the claim form.
So, if a claim got denied for authorization, let's say no authorization on file, what will be your steps, your actions?
Sir, first of all, we need to check whether we have auth on file or not. In case if we have the authorization on file, then we have to call the insurance and make the claim reprocessed by the rep. And in case if we don't have the authorization, then we need to verify whether this insurance provide auth or not.
Which auth?
Prior auth.
Retro.
Yes,
Okay.
sir, retro.
All right.
So actually we have the directive that we don't have to get the auth. We have to code it as a task, and then client work on those denials to get the auth from the insurance. And if those insurance doesn't provide the auth, then we can adjust the balance.
Okay.
Yes.
So, if a claim is not on file,
Yes, sir.
you check status and you found the claim is not on file. So, what will be your steps there?
Sir, first of all, we need to verify that how was the claim submitted. If it is submitted electronically, then we need to check and if there is any ERL rejection or batch failure, or is there any rejection in the submission. And after that, if everything is correct and there is no rejection or submission batch failure, then we need to verify the payer ID with the insurance. Or if we submitted the claim on paper, then we need to verify the address from the insurance. Maybe we are submitting the claim on wrong address. That may be the reason.
Right.
And we also verify the timely filing.
Great. All right. That sounds good. Okay. So, what was your job responsibilities there in NACL? I mean, I just wanted to know how you start your day and how you end it.
Sir, there is a process which I told you the name Adapt. It came in April, so there is a new kind of Adapt Health I manage. So from there we got the invoices. So first of all we have to make the sheet and start working on the invoices. I have the target of 50. So I have gone through the invoices, and we already had the denial reason mentioned over this spreadsheet. So I work according to the denials.
Okay.
Yes, sir.
Okay, then in end?
In end we have to, when we code all the claims, then we have to submit the sheet to our team leader. And her name was Kanika Tiwari.
So you're reporting directly to the team lead?
Yes, sir.
There's no mentors, no SMEs, nothing?
No, sir. She was our team leader, Kanika Tiwari, ma'am.
Okay. All right. Well, are you aware of ICDs?
Yes, sir. International Classification of Diseases.
So what it is?
Sir, ICD is like, we can say G47.33. They specify the disease, illness,
right?
Like those illness, disease, and they specify those kind. Yes, sir.
So, Saurabh, I now wanted to know any of your strengths which you feel that yes, I'm good in this. It can be denials, it can be AR follow-up, it can be calls, it can be review. I mean, whatever you think that yes, I'm good in this.
Sir, I'm good at review. First of all, done the claim by the review. But if there are some insurance for which we don't have the portal and we can't make any, we can't get any status without calling the insurance. Then on this, I call the insurance only in those scenarios. Otherwise,